You are representing room 26. Do share your screen if you are able to. Otherwise, you have 3 minutes to tell us about the situation and the root causes you found and why you believe it's the most interesting and valuable root cause that you can actually take action on.
Okay. Unfortunately, I won't be able to share my screen because I wasn't with my laptop then, but I was able to take notes somewhere else. So for room 26, it was a teamwork, and we were able to come up with the 5 whys. Our root cause analysis problem was poor immunization compliance. Then first why was misconception about vaccination. So why is there misconception about vaccination? This leads us to our second why. It's as a result of misinformation from religious leaders, sometimes social media, withholding old negative beliefs regarding vaccination, and even sometimes it do come from health workers. Then our third why was lack of understanding, as why is there misinformation due to over this vaccination issue. Our third why was lack of understanding and awareness of how vaccine works, because a lot of people have this belief that when they allow their children to be immunized, then there are going to be certain side effects and all of that. So that's our third why. Then our fourth why is lack of information and update on vaccination. So this is the reason why there is lack of understanding and awareness of how vaccines work. Then our fifth why, which is the last why we have, as to the question of why is there lack of information and updates on vaccination, it's because healthcare providers and public health systems are not effectively communicating and disseminating accurate, timely, and culturally sensitive information about vaccination benefits, risk, and schedules to the target population. So this is where we have our 5 whys.
All right, thank you, Nafisa Haruna, for Group 26. We're not going to go to the guides right away, but guides, please prepare your comments for each of the speakers, or in general, once we have heard at least 3. So next will be Professor Becky Tagbo, representing Group 17. Yes, Becky, go ahead.
Yeah, thank you. Yeah, our note taker, Marianne, she can share the screen. She has a laptop to put it down, but I can go on because of the 3 minutes. Marianne, if you are here, you raise your hand so they can enable you to share screen. But I go ahead to make the presentation. So for my room, my group, we did very well, worked together, and our challenge is incomplete vaccination. This is different from non-compliance. We noted that from the last survey, national survey that was done, 36% of our children were fully immunized, but 46 were partially immunized. And this 46 is a whooping proportion of our children. If they all had been fully immunized, then our fully immunized would have been over 80%. So we felt that the impact would be great if we are able to find the root cause why people are able to start off immunization and then they are not able to complete. And so the first why is it that mothers do not complete their immunization? The answer is that mothers often forget their appointments. We have other reasons, but we've chosen that they forget their appointments. So why do mothers forget their appointment? Because they get busy with many other things that they have to do. They're looking for money to take care of their children, going for burials, going for ceremonies. And then why is it that mothers are so busy that they forget to come for immunization? Reason is that they do not prioritize child immunization. So they feel these other activities are more important. They can't leave a ceremony and come for vaccination. And the next question is, why is it that they do not prioritize child immunization? And the answer is that they do not fully understand the value of immunization and the consequences of not vaccinating their children. In other words, they have low disease risk perception. So these are the 5 whys and how we tackle the issue of incomplete immunization. And we feel it will have a great impact. Thank you, and over.
Thank you, Professor Becky Tagbo, for Group 17. Let's go now to Usman Mohammed, and then we'll have follow-up clarifying questions from guides for the groups, and then their feedback and insights. And of course, everyone, this is a peer learning exercise. We are learning from each other. So you can ask any question, share your comments, your thoughts as you go. Do it in the chat, and then raise your hand if you wish to speak. So Usman Mohammed, we're asking you to unmute to present Group 1, I believe was your group. Usman Mohammed, I'm also going to ask, let's see, after Usman Mohammed was actually Boma Otobo for Group 5. So Boma, you are a guide, but it sounds like you may have also been a facilitator. I don't know if you'd like to present Group 5. After that, we have Adamu Galadima Dagona, and then Faith Sangodele on our list for presenters. So let me go to Adamu.
Okay. Shall I go ahead?
Yes. Who is speaking?
Okay. Usman Mohammed.
Yes.
I'm Usman Mohammed from Group 1.
Please go ahead.
Yes, we identified 4 attitude of vaccination team towards vaccination, and we identified as a result of poor immunization coverage. We then asked a question of why, which we've said is as a result of difficulty in terrain reaching the affected community. So our next why is because of the attitudes of the vaccination team, because the place is hard to reach area. So the vaccination team decided to just sit back and not go to the community. And they were just reporting that the community have rejected them. So we asked the next question, why are the vaccination team not going to that community, because it's such a remote area? Then we've identified is as a result of the selection process, which is very poor. As in the beginning, during the selection process, the people selected to administer the vaccination, there's a problem during the selection process. Then we ask why we've identified this as because of nepotism during the selection process. The people selecting have decided to choose the people they want, not the people that are going to do the work. And we ask ourselves, why is there nepotism during the selection process? Then we say because of financial gains. So these are our 5 whys for this root cause analysis in Group 1.
All right. Thank you, Usman Mohammed from Group 1. We've now heard Nafisa Haruna, Becky Tagbo, and Usman Mohammed. I'd like to go now to the guides for feedback and reflections, and maybe also follow-up questions. So, Charlotte, it'd be great to hear from some of the guides who are here, and I hope they're still here, and whose voices we have not heard yet. So they can introduce themselves, and we can honor them properly and thank them for their contribution today.
Yes, Reda, we have Dr. Chinyere Amaka Onubogu that's here. We also have Dr. Odingoma Ikpeze, whom we heard from yesterday, and we have Vivian
Iyekweazu. Yes. So I suggest we start with Vivian Iyekweazu from Nigeria Health Watch. Vivian, you've been a participant and observer of this first activity of the collaborative, what we call Discovery Day. I'd love to hear, first of all, to thank you for joining us. for supporting the health professionals who are here. And then we'd like to ask you to introduce yourself and then share your feedback and reflections for the groups that have presented so far.
Okay, thank you so much, Rita, and hello everybody. As Rita mentioned, my name is Vivian Hikazu. I'm the Managing Director of Nigeria Health Watch, which is a health communications and ethics organization. So yeah, I've been listening through the breakout sessions and in the issues just highlighted. I think there's a lot of commonality in what people have spoken in terms of the root cause analysis. So just very quickly, some of the things I just see resonating. People talk about nepotism and the financial incentives that has made this possible. Something that we do as an organization, we do our Community Health Watch project, and we use that as an avenue to provide a platform for people in the community to report on health and service delivery. So what we often also do is we look at how can people in the community hold their own leaders accountable. And I'm not sure how a mechanism can be developed, but ultimately what this seems to be is people in the community should be some of the voices that hold these health workers accountable when they don't deliver the service that they're expecting. And if it's a case that nepotism is the root cause of the poor service delivery, then if there are avenues that they can use that, their voices, especially mothers who are the users of a lot of these public primary healthcare services, to collectively come together and kind of share those experiences and find an avenue to share those with, whether there is the a community chairman or even influential people in the community, to ensure that they are not the ones who are adversely impacted by that nepotism. One thing that someone was mentioning is in the root cause is the completion of appointments by mothers. I think this is a universal issue because you can imagine a mother of 5 has to take one child for immunization and then the other kids are at home. So there are definitely caregiving support systems that are missing. And also the financial priorities of mothers, or should I say the financial burden that mothers often face in maybe having to go to the market, sell goods, but also take their wards to immunization. So something that I think was mentioned, and I can't remember what one country was, where there are group sessions whereby women come together and there's a group session where women go together to get their child immunized. That way they themselves hold each other accountable to ensure that they do not miss out on appointments, because I do know often if a woman is told to do on her own, then she may not be the one to remember or have that incentive to go. But I think having that group peer support amongst the mothers themselves could be a way of addressing some of these mothers that may be too busy or may not prioritize child immunization, as they don't quite have that risk perception on missing out some of those vital immunization that leads to their kids getting adversely ill, which is a further potential burden. But yeah, those are some of my initial observations. I think the issue of misinformation, I think we'll address that in coming conversations.
Thank you, Vivian Iye Kweazu, who is Managing Director of Nigeria Health Watch, for accepting the invitation to really listen and learn with health professionals from all over the country. Charlotte, which guide shall we hear from next?
Well, I'm inviting Dr. Odigoma Ikpeze. Okay, we also have Dr. Chinyere that's already unmuted. But we'll start with Dr. Odigoma and then we'll turn to Dr. Chinyere.
Okay, good afternoon, everyone. I'm Odigoma Ikpeze, an OB/GYN doctor at Nagaziko University Teaching Hospital, Newi. I'm very happy to be here. I've listened to all the sessions and it's been very insightful. I would like to thank all the 3 speakers, and that's Nafisa, Prof. Becky, and Usman. I would like to address the challenges identified by Usman in Group 1 and then Prof. Becky. Okay, so for Usman, the challenge identified was a poor attitude of vaccination team, poor immunization coverage, basically. Okay, so I don't know, you attributed the challenge to the immunization team, but you also identify that there's a problem with the terrain where they may not be able to reach certain communities. Okay. Sorry. This problem also has a political um problem. So we have to strengthen our political commitment and governance to various communities so that if there's a good road network, the immunization team can actually get to the down routes to the end users more efficiently. Then the incomplete vaccination. I think this problem also will be solved by enhancing our data collection and monitoring. In the more developed countries, they have a way of giving reminders to clients, patients that, okay, your next appointment is so and so date. I think if we're able to keep a good data service and monitoring tool, we can also use that to remind our mothers who are busy catering to so many things in their homes that, okay, it's time for immunization for maybe your second child is so and so. I think that will help us to be able to complete the vaccination. Thank you very much.
Thank you very much indeed, Ikpese Odigonma. We are looking for, from the guides, really insights and suggestions, recommendations, advice, your own experience in one, how to identify correctly and usefully an immunization challenge that matters. And then second, how to do root cause analysis in the best way possible to find the root cause that you can actually do something about. Because every participant in this room by Friday has to do their own root cause analysis in addition to what you have heard here. I'm looking at the clock and it is now 5:30 p.m. in Geneva, Switzerland, 4:30 p.m. in Nigeria, of course. And we are actually at time to be closing the presentations of the groups. I think we are going to be able to take a few more minutes to share the more feedback from the guides who listened with you, who worked with you for some of them, and to listen to their feedback and insights before we close. But before we go any further, I do want to share now the link for the post-session feedback that we're asking everyone to complete by midnight tonight, whether or not you have been able to complete the to participate, or whatever your level of participation. So let me just see here. I'll just paste this in if Charlotte doesn't do it, isn't faster than me, which she usually is. All right, and here. So this is the link that you'll need to be able to share your post-session feedback. And I'm also going to tell you what happens now, but first we'll go a little bit over time. This session ends at the top of the hour, so 5 p.m. West Africa time. We're 29 minutes away, but let's go back to the guides. Charlotte, it'd be good to hear from some more insights and feedback for participants. I see many are self-organizing into their groups. And we'll share some follow-up instructions that should make it easier for you. Remember that you should all be connected to each other on Telegram. But now, Charlotte, who shall we go back to get reflections and feedback from guides? And we've heard only 4. Remember, there were 30 groups, I believe. We've heard only 4 of them. Remember also that every group, your note taker needs to submit your group work tonight for it to be recognized, and your name needs to be on the note taker's notes in the roll call. We'll explain what to do and how to do that, how to check that your note taker has actually submitted. But we'll come back to that after first hearing from more of the guides.
Reda, so we have, as I said earlier, Dr. Chinyere Amaka, whose mic is already unmuted.
Good afternoon, everyone. Thanks for the opportunity to speak. I'm Dr. Amaka Onubogu, a pediatrician. I work in Nnamdi Azikiwe University Teaching Hospital, Nnewi, Anambra State. I'm also the chair of the Maternal and Child Health Committee of the Medical Women Association of Nigeria. So I've listened to the presentations. Those were great presentations, and the one that particularly interested me was the presentation by Group 1 about the difficult terrain, the low immunization coverage in Nigeria, coming from hard to reach areas, difficult terrain. So because this particular challenge has been identified as one of the important causes of zero-dose children in Nigeria, we know that we are home to almost the largest number of zero-dose children in the world, contributing nearly 25% of the world population of children that have never been reached by immunization. And this had to reach difficult terrain is a very important factor. Now, they mentioned that why? Because the vaccinators are unable to reach there. And it's interesting that they noted that one of the reasons could be in the selection of vaccinators. Because if vaccinators were selected from the community and trained well and monitored well, then they'll be able to deliver the vaccines in the community where they live, even though that community is difficult to reach. So that is something that we should really look into in planning vaccination programs to make sure that this difficult terrain areas, these hard to reach areas are mapped out well, and that vaccinators are actually selected from that areas and trained and monitored, and that there is no bias in the selection, no nepotism, as they mentioned. I believe this is a great way of improving our immunization coverage. Thank you very much.
Thank you very much indeed. Charlotte, let's keep hearing from the guide some very interesting and hopefully valuable insights for participants who by Friday need to submit their own root cause analyses, and by tonight need to submit the work that their groups did. Today, of course, it's the note taker who will have that responsibility, but every group participant will be able to go and check that this has indeed been done. So over to you.
Okay, Reda, before we turn towards Jenny, we would like to listen once again to Scholastic and Jackie, our guide on the side from UNICEF.
Thank you very much for this opportunity. My name is Colin Jackie. For those who are not there when I was introducing myself, I work with UNICEF, social and behavior change specialist based in Abuja. I was very glad when one of the groups talked about government prioritizing immunization, and I think this is something that is not just in Nigeria. It's almost all over the world, and we know by not prioritizing immunization, it means that then policies are not friendly to immunization program, resources are not allocated to the immunization program, we are not having enough manpower in terms of human resource put in place for immunization, which at the end of the day affects the output, affects how immunization is conducted in the country. And this is something that when you're looking at SBC, when you're talking ACSM, when you're talking all these names that we give to communication, this is where then advocacy comes in, because we want to be able to, yes, as the worker there at the community level, I'm not able to reach my governor, the LGHR or up until the national level, even the presidency. But we have opportunities where we are able to advocate for inclusion of the immunization agenda in policies at our level. Any opportunity that you're getting to advocate for policies, for resources, for human resources, and building on this, being able to map out what is it that is existing and how can we make it better. The other presentation by Prof. the conflicting priorities. I think if we even go further under the 5 whys, we'll find sometimes it's also societal expectations. What is it that is the role of a woman in the society? They should take care of the kids. They need to cook. They need to be there when the kids are coming back from school. They have all these priorities, they need to juggle in between, and the time is, limited. We have the financial expectation, and also the financial muscle for that woman to be able to take that vaccine, or to be able to avail the child for the vaccine. And this is where then as a society, this is what we expect from expected to do, because immunization contributes and is part of taking care and nurturing of our kids. But then, is the woman empowered enough financially to be able, facilitated enough to be able to avail the children as part of their caregiving to the facility? And also the social norms that, expectations, the cultural norms around. I think these are some of the things that if you really dig deep into the underlying reasons why we are not seeing the women bringing the children to the facility, or availing them, or even prioritizing it as one of their key activities, we'll be able to maybe understand what is really down as the deep cause. Thank you very much.
Thank you very much indeed. We're now 10 minutes over time. We're going to close this Discovery Day.